Hello and welcome. You're watching COVID-19 India Fights Back. I'm Tina Jha. The country continued to witness a decline in new cases of coronavirus on Tuesday. According to the Union Health Ministry, 196,427 fresh cases of the infection were reported from across the country in the last 24 hours. The number of active cases have also gone down further by 133,934 during the same period. However, we are now faced by newer challenges in the form of post-COVID complications that are being reported in large numbers. According to Dr. Randeep Guleria, the director of All India Institute of Medical Sciences, New Delhi, people who have recovered and will recover from COVID-19 will need medical support for a longer period of time. He said there are many patients who will experience several symptoms even after recovering from the coronavirus disease, and they need to be treated for these symptoms. Some of the common symptoms that he spoke about include difficulty in breathing despite normal lung infection and capacity, cough for weeks together, chest pain, anxiety and increased pulse rate, and also chronic fatigue. There's another symptom being seen in those recovered from COVID-19 who find it difficult to concentrate and suffer from insomnia and depression. It is referred to as brain fog and can impact people's cognitive abilities, resulting in mental fatigue. Also, Dr. Gulleria said if these symptoms are seen for 4 to 12 weeks, it is called ongoing symptomatic COVID or post-acute COVID syndrome. But if these symptoms are seen for more than 12 weeks, it is called post-COVID syndrome or a long COVID. So on the show today, we will try and understand from experts all about brain fog, who are the ones being affected by it, and how can it be treated. And we'll also try and analyze the other long-term effects of COVID-19 that are being seen in people and how should we tackle them going forward. So I'm joined on the show today by two distinguished panelists. Let me first introduce them to you. I'm joined on the program by Dr. Anil Gurtu, Director, Professor, Department of Medicine, Lady Hardinge Medical College, and Dr. Manish Suneja, Additional Professor, Medicine, All India Institute of Medical Sciences. Thank you to both my guests for joining me on the program today. Dr. Suneja, let me begin the program today with you. In fact, let's begin talking about brain fog on the program first. What is brain fog? Why is it being seen in patients who have recovered from COVID-19?
So brain fog simply means difficulty in concentration. Now, this is mostly seen in patients who had experienced severe COVID, particularly those who have gone to ICU level of care. So those who are having severe COVID and requiring high level of care, in them we are seeing more of this condition, that is difficulty. Now we must understand, in a normal time, whenever someone is ill, what happens? The entire family is besides the patient, supporting him, giving moral support. But these are difficult times. In the COVID ICU, in the COVID ward, we don't have the family support as we would have liked to have. So all those things, psychological factors do have a role, and this is manifesting later on as a difficulty in concentrating. That is something which we are referring to as brain fog. Now, this is something which may last for a few days to few weeks, a month or two. But most of the times it recovers well, and one should really do a normal exercise, hydration, have a healthy diet, meditation exercises. These are all the general measures that we need to advise for all patients who are recovering from COVID.
Okay, so what are these precautions is something that will come back to you and understand later on in the program. Let me go across to Dr. Gurtu. Dr. Gurtu, is brain fog a pre-existing medical condition, or can it happen to anyone who suffers from COVID-19? Or what are the other factors that could trigger brain fog in the COVID patients?
Brain fog is not really very, very specific to COVID. Now, as was just explained very well, let me highlight on those features. What is brain fog? The word Dr. Manish used was concentration problems. And that's the key to understand why it can happen and why it does happen. Now, when I am talking to you, let's say right now, the first thing that happens is that I attend to you. Without my attending to you, nothing registers. Everything follows after that. Now, this attention is a span. 5 plus minus 2 objects of information can be attended to and retained in a time span. ability to retain it for prolonged periods is called concentration. So attention, concentration leading to registration of my talking to you, my seeing whatever I'm seeing on the camera right now. If this breaks down from anything, I do not register, which means I cannot even recall what I saw, heard, or perceived just a minute ago. How does it manifest in a day-to-day life? I'm talking to you. By the time I finish my sentence, I've forgotten what I began with. I cannot add up the whole picture into one coherent landscape and say, this is what I'm seeing. I'm seeing four people and I'm seeing one doctor, Manish, in front of me. All this capacity to organize, integrate the finer grains of a picture into one total landscape is determined by the first thing, that my capacity to attend. This breaks down, and that is brain fog. Everything follows. Now, this can happen in many other conditions, including hypoxia, including sleep deprivation, including many things that affect the front part of our brain. And once this happens, I cannot attend, my attention span narrows, I cannot retain the focus, my concentration narrows, and hence I cannot recall the immediate scenario unfolding before me. That recall breaks down, and therefore I get confused and I meander this way and that way while I'm talking to you. That is brain fog. I have just elaborated what Dr. Manish had already said so well. Yeah.
But Dr. Gurtu, is it something which is triggered by a pre-existing medical condition?
Not necessarily. Anyone who has a pre-existing mental condition, let's say if I'm 80 plus and I'm having subclinical Alzheimer's dementia or a stroke damaged brain, which is normally in a normal, unstressed going about my life, ways of life, it doesn't really manifest itself in any way. I can manage it. But if there's a stress or a stressor of any type upon my brain by way of COVID, let's say, what happens? That underlying vulnerability surfaces and shows up as confusion, as memory problems. And once that stress abates, it goes away, I recover, I regain back my pre-morbid, my pre-illness status. So it's a fog. And like any fog, it descends and it clears up. Issue is how long. And so long there's a fog before me, I'm confused, I meander this way or that way. Eventually it clears up. 3 months, 6 months, eventually it does. And for that, there are some brain retraining exercises, cognitive restructuring, which could be done through a brain rehab. Yeah.
Okay, so I'll come back to you. Dr. Sureja, coming to you to understand further on the factors that could potentially be triggering this brain fog in the COVID patients now, because it is one of the common symptoms which is being reported now among those who have recovered from COVID. If it is not a pre-existing mental condition, what are the other factors that could be triggering this? Could strong medication be one of the reasons?
Well, as nicely pointed out, so a pre-existing condition like some mental disorders which may get precipitated by the COVID illness, that is one. We do not have sufficient data to say whether any drug per se which we are using for treatment of COVID that is going to lead to this state. No, we do not have sufficient data to say that drugs may be leading to such symptoms as of now.
Okay, and if somebody is actually suffering from brain fog at home, perhaps maybe say if a person does not have a pre-medical condition, how do we identify? Is it something which is recurring in nature, or is it something that could happen once a while?
So this is, as a fog, it is always there. So a patient who is suffering from this would be knowing it. He would be reporting it back in the sense of not able to concentrate in his daily routine activities, not able to remember things. And that is a time when one should consult his physician, do a teleconsultation, explain your symptoms, and we will come to know about it and advise accordingly.
Okay. Dr. Gurtu, if we talk about and understand the impact of brain fog, is it a severe condition? Can it cause severe damage to the brain if it exists, or if it exists for a longer time and the patient is maybe not aware or does not consult a doctor on time?
Brain fog is an what we in medical parlance called an encephalopathy. It's usually transient. It sets in acutely. It goes away slowly. So eventually it does clear up. How fast, how much would determine a lot on the cognitive restructuring, the exercises, brain exercises that we do to help us out of this fog. The other question was, what was the second question?
Can
One
it,
was
how damaging can it be to our
damaging.
brain?
Yeah. See now, this is the brain fog. What you asked me two questions. By the time I finished answering first, I I asked you what's the first question you asked. I mean, I don't have brain fog, but this is just a gist of how people would behave. Now, how damaging it is. Why? Everything we do or we don't, we plan or we don't, everything is determined by perception. And perception is determined by attention. Attention gone, perception broken. Perception broken, I'm confused. And if I'm confused, I wouldn't know where I am, what the time is, what place I am. How do I travel from this place to that place within my own house? How do I cook? In what sequence do I cook? How do I eat without splashing things around? How do I change in such a way that the shirt goes on to my upper part and the pants go to the lower? I mean, these kind of disorientations of body in space and time, person, space, and time, the three axes, they get disoriented relative to each other. And that spells chaos. I cannot even move about in my own house if I'm affected by brain fog severely. So it's totally dysfunctional, and I would need assistance from someone else. Yeah.
Okay. For how long do you think can it linger on in patients who've recovered? But can it be something which can be a prolonged thing?
I have only seen one case in the first wave of brain fog, whom I followed up personally on through telephonic and WhatsApp and all, who was admitted in my ward. He took good over 3 months, 3.5 or so to fully recover, get out. And he eventually did get back. Yeah. So I only have experience of one case. He recovered, 3.5 months or so he took. Yeah.
Okay, Dr. Suneja. So I ask you this again and again because brain fog is something, the terminology is not something that the common people are familiar with. So even if they know that they are suffering from the problem, what are the kind of precautions that they need to take, or what is the kind of treatment that that they need to take?
Well, treatment part, okay, as Dr. Gurtu already pointed out, there are various exercises that one must be doing, like a simple, can do solving puzzles, playing antakshari. So just exercising our brain, so it gradually training, retraining, and this thing goes on. And as Dr. Gurtu said, it's a matter of few weeks, it usually goes off. So it's basically stimulating oneself, using one's memory and trying to remember things. So that is going to take care of this situation. And help of a psychologist if the symptoms are too severe.
Okay, so this is for someone who actually has this problem. For those who have medical conditions, who have mental conditions, but how do they prevent themselves from getting affected by this problem?
Well, I would say we should not get very overawed with this brain fog term. So whenever a new term comes, we are just after it. Like Professor Gurtu nicely said, he has seen just one case in the previous wave. What does that mean? It is not very common. Yes, we are seeing it more this time, a few cases, but still it is a very limited problem. And this is happening, whatever I have seen is happening in patients who had severe illness, went to ICU level of care and then recovered. So, so that is the part when this develops in the acute phase in the first few weeks of the illness. So that is the time that we need to be cautious and listen to the patient's symptoms. Patient may be saying many things, but we have to really dissect through the symptoms and listen to him carefully to really diagnose this condition of brain fog.
Okay. So this is one aspect that we have discussed about brain fog, but then let's also talk about long COVID, which experts are now warning against. They're saying the extent of the damage caused by post-COVID syndrome could affect 1 in 10 Indians after the second wave of COVID-19 ends. So, Dr. Gurtu, Is it the newest battle that COVID survivors may be fighting off, this long COVID syndrome that is being talked about?
We are still in the early days of this second wave, and we wait for next 3 months, because long COVID is defined, as Dr. Manish said also, and you also said, that 3 months and beyond is the timeline when we begin to define it as long or post-COVID. Or how common it will be, I can't say right now, because it's just about beginning to end in Delhi. In the previous wave, we started a post-COVID clinic in our hospital. I was looking after that. We didn't get too many patients, even though we personally rang up, telephoned all the 300 odd patients who were under us admitted. They said they were okay, but this was the first. Now, this time, I am noticing that people 3 weeks post recovery are suffering from 2 or 3 major problems. One is breathlessness. They are not actively COVID. They're not even actively febrile or down with any inflammatory state. Yet they are complaining of, doctor, when I move, I get breathless. That is one. It's more than what I saw last year, impressionistically speaking. I may be wrong. Second is fatigue. Doctor, I'm so exhausted that even after resting, I don't recover my full strength, unlike past. So a fatigue that stays with you even after resting. This summer, a lot are complaining too. Third is problems of feeling anxious, a sense of foreboding. Something will happen, something, I don't know what, but I know something is going to happen and that will be bad. A sense of foreboding and poor sleep. Cannot fall asleep. If fall asleep, keep having multiple awakenings, or awaken earlier than the usual time of one's sleep, waking hour, and not able to go back to sleep again. So sleep, anxiety, a sense of foreboding, extreme fatigue, does not recover fully with rest, and breathlessness, which is very nebulous and you can't place it this way or that way, but it is there as a complaint, as a symptom. These are the three that I am seeing more often at the time of discharge, 3 weeks or so post. However, I don't have data for more than that.
Dr. Suneja, are these the symptoms that you've also been witnessing among patients this time? And how are they different from what we saw in the first wave? Is it because of the new variants that have come in during the second wave?
So I would just like to add here. So like in the first wave follow-up, we had, I know of 2,000 plus patients that we could follow up in the post-COVID clinic. Nearly 30% of them had some symptoms till, let's say, 4 weeks of illness. They had some symptoms. That is with the post-acute period, what we call post-acute COVID. Then in the 4 to 12 weeks, that was the acute period. And the 4 to 12 weeks, that is a post-acute period, the symptoms remain in around 20 to 25% of patients. And the post-COVID, that is beyond 3 months, we are seeing in very less proportion, 10% of patients. So with time, the number of people having symptoms do come down from somewhere, say 30 to 40% to 10 to 15%. As Dr. Gurtu pointed out, those are the common symptoms like fatigue. So we have two symptoms basically, physical and psychological. So physical symptoms most commonly includes fatigue, weakness, lethargy, not able to do his daily course of activity. Yeah. Then this persistent cough or shortness of breath, particularly while climbing stairs, while doing some work of exertion like climbing stairs. In addition, we also noted in a substantial proportion of patients psychological symptoms, which were anxiety, depression, not able to sleep properly, insomnia, and sometimes even panic attacks. So these were the spectrum of problems that we see in such patients. And now the second wave is receding, I would say, for us. We have started following up patients after they have recovered. And as of now, we are observing the same, I would say, the symptomatology, same problems that the patient are coming with, but we don't have the benefit of a long follow-up in this way. Yes, this difficulty to concentrate, inattention, what we are calling brain fog, these are being reported a little bit more frequently than probably what we had seen in the previous wave.
Okay, Dr. Guttu. So obviously, because looking at the number of cases that we've had in the second wave, it's not practically possible to have a long follow up, as Dr. Suneja points out. But if these are common symptoms which people begin to live with and don't pay a lot of attention to, because what the doctors are suggesting, even Dr. Guleria suggested yesterday while addressing the press conference, that these patients will need treatment even after recovering. But in case that doesn't happen, how threatening can it be? Can it affect our organs?
It may it may affect other organs also, though again one has to put it in a perspective. Not that badly, not that commonly. It can involve kidneys. You can have renal failure. Most of the renal failures associated with COVID, acute COVID, recover with good hydration and care. Some may persist. That's one possibility. Nothing to be alarmed about, though. Other is the liver. Most, again, liver inflammations associated with acute COVID recover. There is some very low probability of some lingering beyond as a chronic long-term liver condition. So kidney and liver are two likely organs on which we have to focus attention as the post-COVID time period begins to approach without raising too much alarm. It is not likely to be a very major problem. Some may be. Most of these recover with good management of acute syndrome. Then there could be things like in the brain, a couple of a significant minority of patients with post-COVID develop what we call thrombotic syndromes, blood clotting, which could happen in brain and give rise to either a venous or an arterial stroke. The brain stroke, half of the body gets paralyzed acutely, or a heart attack, MI, myocardial infarction, or a lung pulmonary thrombosis, the blood clots in the lungs, or in the calf cramps and pains, and one leg below the knee swells up with calf cramps and all. So these kind of clotting syndromes raise a possibility of coming on, setting in after 3 months. Though, as I said, with good vigilance and follow up of post-COVID in post-COVID clinics, there shouldn't be an alarm over these things. So good hydration, a good surveillance over one's health, regular visits to the post-COVID clinics, which we are all beginning to start from June. That should be enough without getting too alarmed or anxious about these post-COVID syndromes. Yeah.
Okay, Dr. Soneja. So we've spoken about the different kinds of impact that post-COVID complications could have on our organs, which Dr. Guttu has pointed out. But are the post-COVID complications among children this is of similar kind, or are these complications among children different? And I ask you this because a lot number of children have been infected during the ongoing second wave, and experts are warning that in the third wave, the children could be the most impacted by the pandemic.
Yes, so very nicely enumerated all the problems that we may have after COVID. One point I would just like to add here for adults, that is, I'm speaking about first, is this: we have all this terminology, post-acute, acute, post-COVID. But one thing that we need to remember in the current scenario, one thing one must, particularly a diabetic patient, must monitor is his blood sugars. So now we have this big problem of mucormycosis coming up. Many of the patients who have recovered from COVID, then they come back with symptoms of all those things which may suggest mucormycosis. And the most important preventive thing that can be done is to control the blood sugars. So in addition to whatever in the previous wave, I think this is a new thing that we need to advise. We do advise, always did advise, but probably more emphatically we need to advise our patients. Some of them might have received steroid, which causes increase in sugars. So that sugar needs to be taken care of, that needs to be controlled. Also, diabetic patients, when they receive steroids, their sugars go haywire, very high. So that group of patients, we have to be very particular and bring down the sugar levels, keep the sugar levels under check to prevent appearance of this mucormycosis problem, which is now coming up as a new syndrome within the COVID management part. Coming to the pediatric part, I am not a pediatrician, so I won't really venture long into it, but whatever we have seen managing patients, most of them have a very mild illness and do not require admission. They recover very well at home. Very few patients, children that we have seen admitted while we were managing adults, what we have seen, yes, there is this concept of multi-inflammatory syndromes, multi-organ syndromes, which may happen a few weeks after recovery from COVID in children particularly. But I do believe that it is exceedingly rare. It is very less common. So details, I would really need to consult a pediatrician on it, but that is a very rare condition, nothing to be very alarmed about.
Okay, Dr. Gurtu, what do you think? The multi-system inflammatory syndrome in children that Dr. Suneja pointed out, is it the next cause of concern for the medical fraternity to deal with when we talk about the post-COVID complications?
Basically, I agree with Dr. Manish, what Dr. Manish said, that it is a cause of concern, not a cause of alarm. Mm-hmm. As he said, the multi-inflammatory syndrome in children is not at all common. It's rare. And when it does manifest, it usually comes the third week after recovery from COVID. And 3 weeks after COVID, the fever returns. Eyes become red, both the eyes, red eyes. We call it conjunctivitis. And there's a rashes over the body, of all sorts of rashes, bodies, including the palms and the soles of the feet. That's just about the hint that a layperson who's not a doctor would get, that this could be multi-inflammatory syndrome in a child. Usually 2 to 3 weeks after recovery, these things reappear, rashes and red eyes and fever. Then you should go to a doctor who would do those tests, and it's treatable, completely treatable, and not at all common. Yeah.
Okay, so we're on the final leg of the program now. Let me come to you, Dr. Suneja, first for your concluding remark. We've spoken about the post-COVID complications and the impact it is having on people. Is there a post-COVID follow-up protocol that people can follow?
So all patients of COVID recovered, we do advise to follow COVID-appropriate behavior, to maintain good hydration, a balanced, healthy diet, exercise, breathing exercise in particular, and also to monitor blood sugar. Even if someone is not diabetic and had to receive steroids while being admitted in hospital, it is good to monitor their blood sugars. Now, follow-up protocol would be different based on the severity of illness that one had. So if someone had an asymptomatic or mild illness, probably nothing much needs to be done if there are no new symptoms. Someone with a moderate severe disease who required hospitalization, the protocol would be to follow up more intensely, like someone who required an ICU level of care would require a follow-up maybe at what we do at 2 to 3 weeks interval from the time of discharge with some blood investigations, and really we call them up and find out about the symptom, new symptoms if anything has come up.
Okay, Dr. Gurtu, the final comment from you on what kind of care or how do we care for recovered patients now, considering that they require a longer care now, as Dr. Gulleria pointed out yesterday?
One is breathing exercises. Earlier they are started, the better. Breathing exercises. 2, graded mobilization, a graded physical activity program. 2. And 3rd, for the brain fog, it's imposing a structure on your day-to-day life. And mindfulness. Keep a book, a logbook or diary, some notebook. Record all that's happening in your visual field, in and around you, 360 degrees. Keep a record, keep reminding yourself what you wrote, keep discussing with someone. And that is the practice of mindfulness in whatever way you can. That is the best way out of the brain fog. So breathing exercises, graded exercise program early on, and 3rd, imposing a structure on your life day to day, mindfulness. These are the 4-5 things I would say.
Absolutely. So a couple of recommendations coming in there from both our panelists that can help patients who have recovered from COVID to understand what they're going through, and also they can brace for the post-COVID complications. They can follow up the protocol that the panelists have pointed out and take care of themselves. So with that, I'll have to call it a wrap on this edition of India Fights Back. That's it from us on the show today. Thank you to both my guests for joining me on the program. But before that, I also want to make an appeal to all our viewers. And as both our panelists have also suggested, please continue to maintain COVID-appropriate behavior. That is the most important thing that we need to do on our part, which is continue to wear your masks, double mask up when you step outside, keep washing your hands at regular intervals, and ensure physical distancing. These basic precautions by us will help us as well as our families keep away from the infection. The second wave of the pandemic is not over yet, so we have to continue maintaining the COVID appropriate behavior. So take care of yourselves and your families, and see you again same time tomorrow. Thank you once again.
Rajya Sabha